My name is Ciela Gibbert, and I will be your nurse today. I want to check your armband. Can you also tell me your full name and your date of birth?
My name is Brandon Williams. I was born June 11th, 1999.
Okay. I'm going to do an assessment on you today. I'm going to listen to your anterior and posterior breath sounds. You can put your arms down. I'm also going to be teaching a group of BSN students how to assess lung sounds, anterior and posterior. And I'm also going to teach them a portion about the respiratory system. The respiratory system main function is to supply oxygen to the blood and also to remove carbon dioxide from the body. I'm also going to talk to you some about some of the normal breath sounds and adventitious abnormal breath sounds. And some of the normal breath sounds you might hear is vesicular, bronchovesicular, and also bronchial. Some adventitious breath sounds you might hear, which is be abnormal, would be stridor. You might hear a stridor if someone have a narrowing of their trachea. Bronchi is when secretions are in the bronchus, and coughing can usually clear those secretions. Crackles is secretions in the lung field, and those are usually not removed by coughing. Then you have wheezing. Wheezing is a narrowing of the airways, and you might hear some wheezing with someone who have asthma. Also, if someone has decreased or absent breath sounds, they may have a foreign body or some mucus plug that's located within those lungs. Okay. I'm going to do a little health history on you, so I'll be asking you multiple questions, and I'll need you to answer those for me. Are you allergic to any medications?
No, ma'am.
Okay. Do you take any medications for your chest, including any inhalers?
No, ma'am.
Okay. Do you take any over-the-counter remedies or any home medications?
No, ma'am.
Okay. Do you take any illegal or recreational drugs?
No, ma'am.
Okay. Have you been hospitalized for any type of respiratory conditions? Any bronchitis or anything like that?
No, ma'am.
Okay. Do you have asthma, tuberculosis, emphysema, or bronchitis, or been diagnosed with cancer?
No, ma'am.
Okay, we're also going to ask him, have your family been diagnosed with cancer, or anybody in your family have asthma?
No, ma'am.
Okay, bronchitis or emphysema.
No, ma'am.
Okay. Okay, have you ever smoked?
No, ma'am.
How's your appetite?
Good.
Okay, have you been fatigued, like really tired lately?
No, ma'am.
Do you have any night sweats?
No, ma'am.
Like you're waking up in the night and you just feel like you're wet?
Oh, no, ma'am.
Okay. Do you have any nasal blockage or any type of discharge from your nose?
No, ma'am.
Okay. Have you recently lost weight that's unintentional weight loss?
No, ma'am.
Okay. Tell me, what kind of work do you do?
I cut grass.
Okay. Have you recently been exposed to any type of chemicals, any fumes or dust, mold?
No, ma'am.
What about any asbestos or animal drippings or anything like that?
No, ma'am.
Okay. Do you have a cough?
Yes, ma'am.
Okay. When did it start?
A few days ago.
Okay. And with this cough, is it productive? That means, is it wet or coughing anything up? Or is it dry cough?
It's a dry cough.
Okay. Do you have any pain with this cough?
No, ma'am.
Okay. Do you have any pets or birds in your home?
No, ma'am.
Okay. Have you recently traveled outside of the United States?
No, ma'am.
Okay. Have you been immunized with the flu shot or the pneumonia vaccine?
No, ma'am.
Okay. What we're going to do now, we're going to get ready to want to listen to your breath sounds. And students, what you want to do when you're listening to the breath sounds, you want to ask the patient to sit upright, okay? And you want to start listening at above the clavicle, because you want to get the anterior lung fills. And you want to listen symmetrically from the left to the right side. You want to compare what you're hearing there, okay? You want to warm the stethoscope. Make sure to warm the patient. I'm sure Brandon will have a nice warm stethoscope on him.
Yes, ma'am.
Okay? And you want to make sure that you press the stethoscope firmly against the chest wall when you're listening, okay? And also, I want to mention that you want to listen on full inspirations and full expirations, okay? Okay, I want you to take nice, deep breaths. Breathe in and out for me. In and out. Completes listening to the anterior chest wall. And also, if this was a female, you would want to ask the female to lift up her breast as you listen to the chest wall. Make sure that you get next to the chest wall there. Okay, Brandon, now we're going to listen to your posterior chest wall. We're listening to your lung sounds. Can you turn around in the bed for me? I'm going to need you to face your back, face that way so I can get to your back.
Face this way?
You can turn all the way around to your back, where your back is facing me. Okay. And as we listen with the anterior chest wall, we want to listen the same way with the posterior chest wall. We want to listen symmetrically from side to side. We want to compare the breath sounds, and you want to try to place the stethoscope in the same place as you placed it on each side, on the opposite side. You want to start at the neck there, and you want to progress your way down. Okay, Brandon. Also, we want to ask the patient to bend forward a little bit, bend their head forward, and put their arms across their chest. And this gives you closer, so you can get closer to the chest wall. I want you to take deep in and out breaths for me again, and we're going to listen again on full inspiration and full expiration. Nice in and out breaths for me. Continue to take nice in and out breaths for me. Okay, Brandon, that also concludes listening to your posterior chest wall. And when you're listening to the patient, you want to be observing for any respiratory use of any accessory muscles. That would indicate if the patient is having any type of respiratory distress, or if he's complaining of any shortness of breath. Brandon, you can turn back around for me. And also, students, you want to make sure that you want to document everything that the patient has reported to you. At the same time, you want to be observing the patient for, like I stated earlier, any signs and symptoms of distress. If he said he was shortness of breath, or you notice any accessory muscles, as we stated earlier, is just very important to have good documentation of everything that he said and everything that you saw. Okay, Brandon, do you have any questions about your healthcare concerns today, or about your respiratory problems or your coughing?
No, ma'am.
Okay, alrighty then, that concludes our assessment on anterior and posterior breath sounds, for listening to those breath sounds.